Aloha, and thank you for joining us. Today's Word for Ward, a word with Ward. I'm Representative Gene Ward from District 17, Hawaii Kai to Kalama Valley. Today we have the honor of interviewing one of the world's preeminent cancer researchers. We have with us Dr. Michele Carbone. Dr. Carbone, welcome to the program.
Thank you very much. The honor is mine, by the way, but thank you.
No, a pleasure, because I was at the grand opening of the UH Cancer Center, and I saw and I heard some phenomenal things, and I thought, wow, this is such a, well, it's not a well-kept secret, but it's something that a lot more people need to know about. Before we talk about the Cancer Center, though, I was impressed with, I mean, not only do you look like a rock star, you don't seem to look like the cancer researchers that we have stereotypes of. But what touched me when your background came up was that you are like a 7th generation physician?
Yes.
Isn't that unusual? How did you happen to be 7 generations of physician? What's the background?
My father would have killed me if I didn't become a physician.
You had no option.
Yeah, I didn't have an option. So yes, my father was a medical doctor, my grandfather was a medical doctor, and so on. In fact, I still have all the books that they studied in my house, and you can see how the books become bigger and bigger and bigger and bigger and bigger, to a point that if they keep becoming bigger like that, it will be impossible in a couple of generations to study them. But it's really interesting to see at the Book of Internal Medicine how it keeps growing over the years.
In the beginning, was it so long ago? It was when they were doing leeches and bleeding people?
Oh yeah, talking about the 1700, when I started having, I have books of 1400, in fact, that they were bought by my ancestors.
So is becoming a doctor genetic in your family, or is it?
I don't know.
Yeah, you're a cancer researcher, not a medical researcher.
Well, cancer is part of medicine.
That's true. And we're going to find all about that. But the other thing that I was reading in your background is that in 1994 you were knighted. So you are Sir Michele Carbone. Is that correct?
Yeah.
This is a knighthood.
Yeah.
What did the Italian government say?
Why did
you become a knight?
I became a knight for scientific achievements. They were very nice to me, and they thought the president of Italy nicely decided to knight me. And there was a big ceremony because I couldn't go back to Italy at the Italian consulate in Chicago years ago.
Oh, so you weren't even there at the presentation? Or?
I was supposed to go to Italy to the president, where there is in the president ink, but I couldn't because of work, so it was done at the Italian consulate in Chicago. But it was a very nice ceremony. A lot of friends came by.
I mean, there's not too many sirs around, especially from the UK and the others that have that. Anything else we should know about your background?
I don't know what you want to know, sir. I was born in Roma, and I came to the United States when I came in America. In 1886, I worked 8 years at the National Institute of Health in Bethesda. Then I moved to Chicago. I worked at the University of Chicago. I worked at the Loyola University Cancer Center. Then they offered me a job here, and I moved here in 2006.
And the rest is history.
And the rest is a very nice history.
And yes. Are your children, I must ask, are your children going to become doctors? And you have children?
I have 2 daughters. I am not like my father who tells my children what to do. So I have a kid who is already grown up, and she got she's a chemical engineer. She got and she works already, and she's great. And the other one is as great, and she is in high school, and we'll find out what she's going to do when she grows up.
Otherwise, you've heard it first. This may be the first of breaking the Carbone tradition of producing medical doctors. Let's go right into your directorship at the UH Cancer Center.
Yes.
You've got a beautiful new building. What are you going to do in that building, or what's going on there right now? Tell us a bit about that facility.
The facility is beautiful, as you say.
In Kaka'ako.
It's really a beautiful facility. It's rated right now, is one of the best cancer center building in the country. In fact, it's rated the best cancer center building in the country, which I think is something that the residents of the state should be very proud of, because it was entirely designed and built here in Hawaii. And it was designed in such a way that you have visited it to take advantage of the unique place where we are, with open spaces, so that people can meet in not in an AC room without windows, but in a place that
a lot of flow through.
Right, flow through, and a lot of meeting areas that are conducive of collaboration. So it's a wonderful cancer certain building. We needed a cancer center building because the facilities that we had was very old and very out of touch with any other facility existing in the United States. So if you wanted to, no, if you want, we want to keep this cancer center as a top cancer center in the country, to attract people, to keep people here. We need to be able to offer the same facilities that you would have in Boston, in New York, in Baltimore, in San Francisco, everywhere else.
What about world class? Would it fit into the London and the Paris and the other medical centers?
Most definitely.
Okay.
Most definitely this cancer center, the goal, what you ask me, what I want to do with it. This has to be one of the best cancer centers in the world, the place where people come from all over the world. And the reason that they want to come here is that why would you want to go to Houston if you have the options to come here, right? I mean, you have the advantage here that this is the most beautiful place on earth. So if you can offer in the most beautiful place on earth that everybody can agree on, a cancer center with comparable facilities of what you could find in Baltimore or in Houston, who wants to go to Houston?
I'm one of those who think anything that we do in Hawaii should be world class. And when R.C. Greenwood was giving me the tour of that, I got the sense that this was world class, but I wanted to get directly from you and for you on tape to say this is world class, and it can be and it should be, and it's got all the makings of that. What are some of the things that's been going on there so far? What's the research focus that might...
The Cancer Center is organized in 4 major departments that focus on the various areas of cancer. So one area is cancer prevention, because nobody wants to get sick in the first place, right? Given the choice, you don't want to get sick. The area of, another area is cancer biology that deals with understanding the mechanism by which people develop disease. Another area is cancer epidemiology that studies the different incidence of cancer in different populations or in different ethnic groups, and allows you to make correlation and then study how you can intervene on those correlations to decrease, for example, the incidence of cancer. And the new area that we are developing now is experimental therapeutics, which is developing new drugs, developing new therapies, developing new ways to prevent or to treat cancer. All the 4 program works together with our clinicians so that whatever is developed in the basic science lab then can be moved to the patient's bed and to treatment.
So all that's going on right down the street in Kaka'ako.
All that is going
all
on
the
right
new
now.
drugs even. The
new drugs is a new initiative that we started in the past 2 years. I recruited Dr. Tucson from University of Florida. He's one of the leaders in experimental therapeutics and pharmacology. And there are reasons for that. One of the reasons is that we can take advantage of the unique environment in which we live to isolate from natural products new drugs. So there is an extensive activity around that. The other reason is that with the change in economy that we are facing, we need to adapt to the changes in economy and look at other possible sources of revenues. One area that has not been tapped here yet at all is patenting and revenues that come from patenting. So we are looking into areas of science that can bring a significant amount of revenue in along the line of the strategy that we need to be self-sufficient to continue to grow in the new economy in which we are right now, because we can't keep coming to you and ask for money.
Say that's music to the legislative ears.
You're going to tell me that you do not have money. And so we have to look at areas that have tremendous potential to bring money in. And given where we are and the possibilities that we have to study here, that certainly is one of our first priorities.
If we step back and look at the face of cancer, if we look at it from a world perspective, what's going on with cancer in all populations, all countries, all ethnic groups, and then if we look at it from the U.S. and then from Hawaii, what kind of a picture is being painted from that broader to the very narrow?
Well, on the broader side, you have more cancers, more people develop cancer.
Whether it's rich, poor, or otherwise.
Rich, poor, doesn't matter. Well, the reason is a good reason, and that is that people are getting older much often than not. So cancer is a disease that prevalently hits people in their last, when they become 65 and older, 60 and older.
Okay, so age.
That's the group of people. The older you become, the more the incidence of cancer usually. So, except for certain particular cancer. So, because we have been so good to bring so many more people into the 70s and 80s, necessarily we have more cancer.
Okay.
Okay. So, the reason that we have more cancer, if you want, is a good reason. That many more people make to the age where you develop cancer. Many cancers today can be prevented, can be treated. We have much more effective ways to treat cancer. We do not see that because that is kind of overall picture, because that is counterbalanced by the enormous larger number of people who become old. So what that means is that we had a lot of successes in our fight against cancer, but the cancer remains one of the main reasons that people die. I mean, 1 out of 4 people or 1 out of 3 people dies of cancer. And so we all know, unfortunately, people who we love who died of cancer, being in the family or being friends. I doubt that there is anybody who says, I don't know anybody who got cancer, because it's too much of a common disease. We have to die. There is nothing we can do about that. But given the choice, I don't think anybody chooses to die of cancer.
I think you're probably right on that.
Okay?
Very, very true.
So our job is to be sure, the critical job of the Cancer Center of Hawaii is to be sure that less people develop cancer in Hawaii, that you develop cancer as late as possible, so that probably you're not going to die of cancer but of something else, to develop new ways to treat cancer, and to be sure that people in Hawaii have access to the same options for prevention and for therapy that they would if they were living, say, in Chicago or in one other major city in the United States of America. People here, the goal of this cancer center is to be sure that we can provide that to the state of Hawaii, that people do not feel anymore, as they still feel many times, that when they have a diagnosis of cancer, they need to get on a plane and go to Mayo Clinic or to go to Houston or somewhere else. I wanted that they feel, rightly so, that in fact here they have all the options that they need.
So the people listening to this program have just been invited to use the UH Cancer Center. How would they go about doing that? What's the collaboration between you and the existing hospitals, existing doctors? How can they see the everyday linkage?
It's really wonderful. When we started the process, there was this big problem, that was that the university, as you know, does not have a hospital, and the hospital are here. So how do you run a cancer center if you do not have a hospital? It can't be done, okay? At the same time, the hospital had another problem, and that is that if you want to attract here some of the top physicians, scientists, academicians that move the field forward, it's very difficult to attract people in a private hospitals because they expect to work in an academic center. So how you do that? Well, the way we did that, and it's worked very well, is we formed a consortium. So the Cancer Center is in fact the University of Hawaii Cancer Center Consortium. It's recognized as such by the federal government and National Cancer Institute. So now we are an official consortium from federal point of view between the University of Hawaii Cancer Center together with 3 of the major hospitals in town. Hawaii Pacific Health System of Hospitals, Queen Medical Center, and Kwakini. So being a consortium means that we can afford what each one of us otherwise couldn't, because we are truly sharing the resources. For example, before, just to give you an example, there were 4 clinical trial units. 1 at University of Hawaii, 1 of each for these 3 hospital systems that I told you. Now we have 1 single clinical trial unit that covers the whole situation. That, of course, results in significant savings, but also in a much more integrated system, because you know, once you have a patient, where is that patient should be to have the appropriate clinical trial, because it's working together.
By clinical trial, you mean what?
Clinical trials are the new therapies that come out, the new treatments, the most modern treatments, cutting-edge stuff that is being moved into the clinic, and that is not yet standard of care. Usually these are promoted through the network of what is called NCI, National Cancer Institute designated cancer centers. We are one of the 67 in the United States of such cancer centers, and therefore our patients through the Cancer Center of Hawaii have access to these clinical trials as if they were in another cancer center.
So the people of Hawaii can have the latest cutting edge drugs through the UH Cancer Center because it's NCI certified, which means you're the top of the the class, so to speak, then.
We are the top of the class, and I like to say we, because we really are a consortium, and we are working with Queen, with HPH, with Quacchini, and we really are working as a team. Now, this is a new team that has been put together.
Yeah, how old is the team now?
Well, we put it on paper 3 years ago, started to be working in 1 year ago, and I think that there is a lot of room to make the team much more synergistic, but there is a lot of enthusiasm, and the skepticism that some had that this thing would not work, in fact, fortunately, has proven wrong, and everybody is very excited to work together, especially because in economy like this one, it's much easier to put resources together and share. It's like going out for dinner, right? If you have to pay for everybody at the dinner, then maybe you don't go out for dinner. But if everybody pays for the dinner, then it's easier to go out for dinner. Same concept.
Speaking of paying one's own way, in the inaugural opening of the center, you had some very fond words to say about Senator Inouye, and you had his wife there. Senator Inouye was very instrumental, and I know there's a lot of things that he's done that a lot of people never knew about. You want to mention Senator Inouye's role in the Cancer Center?
Senator Inouye really wanted this Cancer Center to happen, and was one of the strong voices behind the Cancer Center developing and be successful. And he was able to secure a grant of $10 million from the feds that helped towards the construction of the Cancer Center. He was at the groundbreaking ceremony of the Cancer Center when it finally started, and he was very happy because he said he had tried many years to see this thing going, and he was very happy, and he was going to come to the inauguration. And so we were very disappointed that he, in fact, was the reason that we set the inauguration that day, because he said that day he was going to be here in town, and so he wanted the inauguration to happen that day. And we knew that meant so much for him, and was really sad that, in fact, he could not be at the inauguration. But certainly he was there with his spirit and everything else.
You paid great tribute to him, and I'm sure he would be so proud of what the facilities that you put together. But again, for the relevance for the person on the street, you're saying through those 3 hospitals, they are essentially linked to you guys right at the UH Cancer Center, if they participate in any of these 3 hospitals.
Right.
What if they go to Kaiser then? They're not involved, or what?
No, right now Kaiser is not part of the consortium, and the reason is that when you put something together, the more people you put around the table, I don't want to make a joke, but the more lawyers have to come around the table.
No, it's true. We're surrounded by them in this building.
And the more complicated the thing becomes. So the idea was, let's create it, let's make it work, and then once the thing is working, then let's have, hopefully, other hospitals participating into the system if they wish to. But let's first get it started, otherwise we risk to have so many meetings that then this thing will never start.
Exactly. Cancer Center's got to have super crackerjack researchers. How many Cancer Center professors, researchers have you got, and how many faculty will you need?
Going forward in the next 3 years to meet the new demands of the NCI that have increased, and to grow our Cancer Center that remains one of the smallest in the country, and to have the critical mass that is needed to be self-sustained, we need to hire about 20 more faculty. During the past 4 years, we have hired about 20 faculty into the Cancer Center, so there has been a tremendous growth.
About half full then, sort of a little bit more than half.
No, we
25,
are...
you need 20 more?
Well, I would say that we are not half full. We are more than half full. We are almost full. But there is another area that we hope to complete in the next few years, and so that we can fill that too. But we need to bring another 20 more to be competitive with other cancer centers in the country. What is important to understand is that in the research field in which we are, we live by competing with others. And the competition, because the resources are less and less, it's very tough. Nobody gives you something. So you need to have the best scientists, you have to have the best physicians in order to win those limited amount of resources that are out there. Every cancer center in the country wants to become NCI designated. One way that they have to become NCI designated is if they kick you out. So you need to be very strong because you are holding a place that many people want. Does that make sense?
Well, being one of the best and now having the best environment with the longest lifespan in the nation, what are the back to the question of the face of cancer, what kind of cancers still come to Hawaii, in which ethnic groups? What's the profile look like?
Well, of course, we are not immune from any cancer, so every cancer strikes Hawaii. Then there are some cancers that strike Hawaii more than others. A typical example is liver cancer, which is a very aggressive cancer that can be treated only when it's detected at an early stage. But when it's detected at an advanced stage, then it's not responsive to therapy. We have twice as much liver cancer per 100,000 people than any other state in the United States. So the incidence of liver cancer here not only is higher than anybody else, but twice as much as the second state.
So that's a geographical phenomenon. It's not an ethnic issue or...
No, it's an ethnic issue.
Well, it is an ethnic issue.
Yes, and the reason is that liver cancer strikes predominantly people from Asian descent. And we have a lot of Asians here. So that's why we have so much liver cancer. And liver cancer here is caused prevalently by hepatitis B. Instead, in the rest of the United States, is caused prevalently by hepatitis C. So it's a disease that strikes Hawaii prevalently.
Do we know how to explain that or why that's the case?
Yes, because some groups from Asia were not vaccinated against hepatitis B, and also because hepatitis B virus can be transferred from mother to child during gestation, and that can resist vaccination. So that's why we have so much liver cancer here. And that's why that is one of the priorities of the Cancer Center at Hawaii. And we have put together a liver cancer team that is headed by Dr. Linda Wong, who is a surgeon, who now works at Queen Medical Center. And she treats almost every patient with liver cancer in Hawaii. About 90% of people who have had surgery for liver cancer were treated by Linda. We put together a team of people around Linda. We found the resources through the fact that we are an NCI designated. There was, for example, a grant that is only available to NCI designated cancer center. And this was $1.3 million that we gave to her to put together this team. One of the members of her team, Dr. Sandy Kui, who is a radiologist who works also at Queen, Sandy developed a new radiological method that appears to be more sensitive to detect liver cancer at the early stages. This has already passed phase 1, phase 2 clinical trial. Now it's in verification, that is phase 3 clinical trial. If it holds true that this methodology is in fact more sensitive than others, then we'll have an immediate impact here in Hawaii to people for liver cancer, but of course has an impact all over because will be a technology that is used all over. So there you see how in fact we are studying something that is relevant here to Hawaii, but if it works the way that it appears, it's going to work back in the rest of the world. And we patented it, so that money, if in fact works out, is going to bring revenue through patenting into here.
And that means the state of Hawaii.
That means the state of Hawaii, right.
Which is exactly of the interest of some of our colleagues here. But what if we look frankly at the state of the art of cancer research? Are we making headway? As you said, it's one of the #1 killers. If you catch it, you might be able to control it. But is there a way of preventing it, or are we just sort of we still in the foothills? Or are we kind of climbing the mountain to say, we're going to find out a cure for cancer?
Look, you're not going to find the cure for cancer that cures all the cancer, because cancers are caused by different things in different people. Therefore, you cannot look at cancer as one disease, but diseases that are different from one each other. So you can cure one at a time. But
so how many different kinds are there then?
You know, I never counted them, but count how many organs there are. Each organ can usually have 4 or 5 different types of cancer, and I don't know. I never counted
hundreds,
them.
maybe
but you're gonna
thousands.
I think on the hundreds for sure.
Whew.
So you're going to have different types of cancer. You can find cures or ways to prevent cancer for different types. Now, there are some things you can do, okay? The general estimate is that about 50% of cancers are caused by either by smoke, by the fact that people are significantly overweight, so by diet, by combination of diet and smoke, and exposure to carcinogens such as asbestos. Things like that are fully preventable. So if we were able to intervene on those things at the prevention side and you could have eliminate 50% of cancers, that would be a phenomenal thing that you could do. And that is within the range of things that we can do tomorrow morning. The fact that we don't do it is another story. But it's certainly within the range of things that is achievable very easy. Eat well,
That's 50%
don't smoke,
right there.
and that's 50%. Of course, there is another part of people who say, well, I never smoked in my life, I ate well, I ran every day, and still here I am and I got cancer. Why is that? Well, because there is the other 50%, unfortunately. And there are different causes. Some cancers are caused by viruses. I hosted here Dr. Baruch Bloomberg, who won the Nobel Prize because he discovered that first the virus of hepatitis B, then he discovered that the viruses of hepatitis B caused liver cancer, and then made the vaccine for liver cancer. He is the WHO, the World Health Organization, estimates that his vaccine saves about 1 million people each year from dying of liver cancer. Now, there you see a tremendous impact that medicine has done. The fact is that when you work on cancer prevention, that million people, that could include me and you, will never call Dr. Bloomberg and say, thank you for saving my life, because I don't know if that I was, for example, one of those million people who, thanks to his vaccine, didn't get it. But there you see the tremendous impact that medicine can do. Another example is cervical carcinoma of women. You know, the pap test. This was a cytologist from Greece, Dr. Papanikolaou, who invented the pap test. And cervical carcinoma was all over the world the #1 cause of death. And the incidence of cervical carcinoma has gone in the single digits, thanks to Dr. Papanikolaou preventive test. None of those women sends flowers to Dr. Papanikolaou. But
Dr. Carbone, unfortunately, the #1 cause of cutting you short is that we've run out of time. We don't have enough time to thank you for all that you're doing at the UH Cancer Research, but I hope people have got a better view of what we're doing right here in Hawaii on a world-class basis with a gentleman who has given his life for 7 generations in his family for the prevention of disease. Dr. Carbone, thank you very much on behalf of the people of Hawaii. Appreciate
Thank you.
it. Thank you for viewing. This is Representative Gene Ward saying aloha.